Today we are dissecting the legal aspects of nursing, a critical and frequently tested area on the NCLEX. The exam will not ask you to cite specific laws, but it will demand you apply legal principles to clinical scenarios. Let's start with the Nurse Practice Act. This is what defines your scope of practice in your state, and the NCLEX loves to test this through delegation questions. For example, a question might ask if an RN can delegate the administration of an IV push medication to an LPN. The answer depends on the state's Nurse Practice Act, but typically, complex tasks like IV pushes are reserved for the RN. The exam trap here is not just knowing what you can delegate, but understanding why. You can delegate tasks, but you can never delegate the nursing process itself, so assessment, diagnosis, planning, and evaluation remain your responsibility. Now, let's clarify the difference between negligence and malpractice, as the exam often uses these terms to confuse test takers. Negligence is failing to act as a reasonably prudent person would. Malpractice is a specific type of negligence committed by a professional. The key is the professional standard of care. For a finding of malpractice, 4 specific elements must be proven. Here is your essential mnemonic for the exam. The 4 Ds of malpractice. They are duty, dereliction, direct cause, and damages. First is duty. This means a professional nurse-patient relationship existed. On the exam, this is established simply by the nurse being assigned to care for the patient. Second is dereliction, which is a breach of that duty. This means the nurse failed to meet the established standard of care. An exam question might describe a nurse who fails to check a patient's identification band before administering a blood transfusion. That is a clear breach of duty. Third, and this is the most common exam trap, is direct cause. The breach of duty must be the direct cause of the patient's injury. Imagine that same nurse gave the wrong blood type, and the patient had a severe transfusion reaction. That is direct cause. But what if the nurse forgot to document a patient's output for one shift, and later that day, the patient had a stroke completely unrelated to their fluid status? While the documentation was a breach of duty, it did not directly cause the stroke, so malpractice would not be established. The NCLEX will present scenarios where a breach exists, but causation is missing, and you must identify that missing link. The final element is damages. The patient must have suffered a physical, emotional, or financial injury as a result of the breach. The transfusion reaction causing an extended ICU stay and medical bills would be clear damages. Another major legal area is documentation. Your mantra for the NCLEX should be, if it was not charted, it was not done. The patient's chart is a legal document. An exam question might involve a patient who fell. One nurse's note is vague, stating patient found on floor. Another is detailed, patient found on floor next to bed, alert and oriented, denies pain, full range of motion in all extremities, neurochecks within normal limits, physician notified, and new orders received. The second note demonstrates the nurse met the standard of care by assessing and responding appropriately, which is legally protective. The NCLEX will test your ability to recognize legally sound documentation. Vague, subjective, or incomplete charting is always a red flag. Finally, be aware of intentional torts like assault, which is the threat of harm, and battery, which is actual unwanted physical contact. Telling a combative patient, if you do not take this pill, I will hold you down and force you, is assault. Actually forcing the medication is battery. False imprisonment, such as applying restraints without a proper order or justification, is another area the NCLEX may test. Always link these actions back to patient rights and informed consent.